The cause of death was listed as accidental fall. The medical examiner disagreed, citing significant discrepancies in the traumatic head injuries sustained by the deceased, which suggested a more complex and violent mechanism than initially presumed. The case closed 3 times. Each closure was based on incomplete forensic analysis. Upon re-examination, subtle yet critical signs of blunt force trauma were identified around the neck and facial regions, indicative of manual strangulation prior to the fall. This revelation shifted the investigation from accidental death to a potential homicide scenario. Further examination uncovered defensive wounds on the arms, corroborating evidence of a struggle preceding the fatal injuries. The postmortem findings indicated a sequence of events that necessitated a thorough reevaluation of all available evidence and witness testimonies. Chapter: Case background. The incident under review occurred on October 15th at approximately 7:30 p.m. in a residential apartment complex located in downtown Seattle, Washington. The initial report was received from a neighbor who heard a loud thud followed by silence and proceeded to knock on the deceased's door when no response was given over several minutes. Upon entering due to concerns for safety and recognizing that entry might be necessary under exigent circumstances, the responding individual discovered the deceased lying motionless on the floor of their living room. Initial observations suggested that the deceased had sustained significant trauma to the head, with visible contusions and lacerations indicative of blunt force impact. There were no signs of forced entry or struggle within the apartment, leading investigators initially to consider a fall from standing height as the primary mechanism of injury. The neighbor's report did not provide any additional information regarding potential witnesses or suspicious circumstances prior to discovery. Chapter: Initial findings. Upon arrival at the scene, first responders noted a single individual lying supine on a bedroom floor. The room exhibited no signs of forced entry or struggle. There were no visible blood spatter patterns indicative of injury sustained in situ. The deceased presented with no apparent external injuries to the head, neck, chest, abdomen, or extremities that would suggest immediate trauma. Initial medical assessment by emergency personnel revealed the absence of a pulse and spontaneous respirations, indicating non-viability at time of discovery. A preliminary examination did not uncover any obvious signs of acute intoxication or drug use. Given the lack of apparent external injuries, the cause of death was tentatively classified as undetermined, necessitating an autopsy for further evaluation. The body's supine position and absence of defensive wounds suggested natural causes or a fall with minimal impact, though trauma could not be entirely ruled out without comprehensive examination. This assessment prompted immediate referral to forensic pathology for detailed investigation into the manner and cause of death. Chapter: Forensic investigation at the examination site. A comprehensive collection process was initiated to document all relevant physical evidence related to traumatic head injuries sustained by the deceased. Forensic investigators meticulously documented and collected debris from the area of impact, including fragmented tiles and splintered wood consistent with a fall from height. The presence of hair and skin particles adhering to these materials provided potential comparative samples for identification purposes. Notably absent were any signs of defensive wounds or secondary impacts suggesting a single traumatic event. Collected items were sealed in evidence bags and labeled according to standard protocol, ensuring an unbroken chain of custody throughout transportation to the forensic laboratory. The laboratory analysis included a comprehensive panel of tests to evaluate the presence and extent of traumatic injuries sustained by the deceased. Initial radiological imaging confirmed multiple fractures in the cranial vault, necessitating detailed histopathological examination. Tissue samples from the brain parenchyma were subjected to macroscopic inspection for hemorrhage and contusion patterns. Microscopically, there was evidence of acute subdural hematoma with red blood cell extravasation into white matter tracts. Hemoglobin levels in cerebrospinal fluid were quantified at 120 mg/dl, indicative of significant intracranial bleeding. Blood alcohol concentration, BAC, was determined to be 0.08 g/dl, within the legal limit for intoxication. Toxicology screens revealed no presence of illicit substances or medications that could contribute to altered consciousness and increased fall risk. The findings collectively support a diagnosis of traumatic brain injury resulting from an acute blunt force impact to the head. The examination of forensic evidence indicated that the deceased sustained traumatic head injuries consistent with a fall from a significant height. Analysis of impact patterns on both the scalp and skull corroborated this finding, suggesting an initial collision with a hard surface followed by secondary impacts. Soil particles found embedded in abrasions provided a temporal reference point through radiocarbon dating, estimating the postmortem interval to within 24 hours of discovery, with high confidence levels due to minimal environmental contamination. This timeline confirmed that the injuries were sustained shortly before death and contradicted theories involving prolonged survival or multiple incidents leading up to the fatal fall. The sequence of events established a clear causality between the traumatic impact and the immediate cessation of life functions, ruling out any other contributing factors such as pre-existing conditions or subsequent traumas. The forensic examination revealed significant traumatic head injuries consistent with a fall from a considerable height. Fractures to the occipital bone and multiple cerebral contusions indicate a severe impact, corroborated by witness accounts of an audible thud followed by unconsciousness. Microscopic analysis of brain tissue disclosed acute hemorrhage and neuronal damage, supporting the conclusion that intracranial pressure was rapidly elevated, leading to loss of consciousness and subsequent demise. The pattern of injuries on the skull and scalp suggested a single impact event rather than multiple falls or assaults. While forensic evidence unequivocally points to the cause of death being traumatic brain injury sustained from an acute fall, certain environmental factors, such as surface material at impact, remain interpretive without further context. Under oath, I would assert that the fatal injuries were consistent with a single traumatic incident, resulting in immediate incapacitation and subsequent fatality due to intracranial trauma. Chapter Resolution. The final determination of this case involved a thorough reevaluation of all available evidence, including autopsy findings, witness statements, and physical evidence at the scene. Initially, the cause of death was considered undetermined due to conflicting signs of trauma and lack of clear fall mechanics. However, subsequent analysis revealed significant traumatic head injuries consistent with a high-impact fall from considerable height. This included multiple fractures of the skull and brain contusions indicative of severe deceleration forces. CT scans confirmed intracranial hemorrhage, supporting the diagnosis of fatal head injury secondary to blunt force trauma consistent with a fall. Witness testimony corroborated that the deceased was observed on an elevated surface prior to the incident. Reconstructed video footage provided additional context, showing the victim's position relative to the edge and environmental factors such as wind speed, which influence stability. This evidence shifted the initial assessment from uncertain accidental cause to a definitive traumatic injury resulting in death. The central finding of traumatic head injuries was thus firmly established, resolving ambiguity surrounding the circumstances leading to fatal outcome. This examination underscores the meticulous approach required in assessing traumatic head injuries as a cause of death, highlighting the importance of comprehensive neuropathological analysis and thorough scene investigation for accurate determination of fatal mechanisms. The central finding of traumatic head injuries was thus firmly established, resolving ambiguity surrounding the circumstances leading to fatal outcome. The file remains open,